So often we divide physical health or physical pain and mental health pain. But today I want you to check out this clip of this medical doctor talking about his patients and some of the pain they're going through. Listen to this.
Different traumas can actually show up as physical ailments later in life.
Really?
Like I'll have patients come in with back pain, elbow pain, carpal tunnel symptoms, and it's happening as a result of mental health trauma they experienced as a child.
What? How do you work through that then?
Well, first you have to be honest and do a proper workup and make sure it's not anatomical. I have to do a proper history, I have to do a physical exam. We have to get an imaging to make sure there's nothing going on anatomically. Again, there's no tear, there's no broken bones, all that. And then you see if the patient is open to it. You have to say, hey, I think that I've ruled out everything anatomically that could be wrong. And I'm thinking that this is real. You are feeling this. I'm not saying this is in your head. The root cause is coming from something mental health related. Do you want to try and talk about that? And if they're open to it, we do it. And it works a lot. We have pains all the time. We have aches as humans from sitting too long, from driving, from this, from playing sports, whatever it is. And what controls the volume of the pain is our mental health.
So many people, this might be the first time they're hearing that a mental health problem could show up as a physical problem. Like you could have back pain, you could have joint pain, you could have stomach issues, you could have heart problems, you could have headaches from mental health obstacles or struggles that came your way in years earlier. Sounds pretty unbelievable, right? Now you're listening to this thinking, Daniel, is this new research? To which I might surprise you for the second time and say no. Arguably the most influential psychologist of all time was a medical doctor by the name of Dr. Sigmund Freud. And over 100 years ago, in the year like 1893, he was talking about repressed memories. Or excuse me, I should say from 1890 to like 1920s, repressed memories. And his idea or his beliefs at the time were that an individual could undergo some sort of a hardship, some sort of a struggle. They would carry that with them everywhere they went unconsciously. So if something really hard happened to you as a kid, mental health wise, maybe it was abuse, maybe it was emotional neglect, maybe it was the way somebody talked to you, you would carry that with you into your relationships in the future, into work, into the way that you saw the world, and it would have physiological symptoms that it would be manifested as, right? Now, what's important to note was that Freud went to medical school and then he specialized in neurology. So essentially what he was looking at people who had seizures or things like Alzheimer's, things in that regard. And what he noted was there were a lot of these people whose brains did not appear to be the brains of the people who had Alzheimer's or who were having seizures or things of that nature. But these people were deeply, deeply distressed. That's where these origins of like the unconscious came from. He's going, you have these certain memories that you're not even aware of that are causing you physical pain. And most of his patients were like women in their 30s and 40s. And they were telling him about things that happened when they were 10 or 15 years old. Now, right now in 2024, I haven't been able to find any research which backs up this idea of repressed memories. Repression, in this sense, I mean this idea of something so outrageous or harmful happens to me, and I actively forget that memory. Later on in my life, I feel so sad. I don't know why. I talk to a psychologist and I remember it again. I haven't seen much data on that. But what I have seen a plethora of research on is things that make an individual so upset, they just try not to think about it, or they suppress it, or they try to change their mind. And then when they go to a psychologist because they're upset, the root of it is that thing that they tried to forget about, that thing that they try to suppress, that thing that keeps them up at night, right? And those are different things. Repression is like you literally forget, whereas suppression with an S, I just tell myself, don't think about it, don't think about it, think about something else, think about, right? Whenever I start to have the memory of what happened when I was a kid, I hit my vape pen, or I turn up my music so loud that I can't hear my own thoughts. So this idea of mental health troubles being physical pains has been around for a very long time, right? But we don't talk about it. And I think because people don't know, and because if you haven't done the research, it sounds woo-woo. It sounds too crazy to be true. There are so many articles, folks, out there on PTSD and the impact that that has on the body. Like everything that I said earlier about the heart, GI tract issues, joint pain, arthritis, headaches. One of the things that we see a lot in people who have PTSD and then who go to court is it has an impact on their concentration, their focus, their memory in the moment, and some very real physical symptoms. Now, one of the things that Dr. Mike said, which I loved, is look, we first have to rule out that there's nothing anatomical going on here, right? Once we do the scans and like we see, we look at your joints, or we look at the individual organs, or we run the blood test and we see that everything is in the range that it should be, then we start looking at mental health as being another possible option. And another thing I loved is he was so collaborative on it, right? This isn't saying, look, you have pain, it's all in your head. No. It's you have pain. We're trying to find the root of the pain. And this really weird thing we do in mental health and really in health in general is if I have hard elbow pain, like if my elbow is excruciatingly painful, where is the pain coming from? Everybody says, well, Daniel, it's your elbow. Right. A little bit more specifically, we're talking about my pain receptors, right? My nerves. So if you hit me with anesthesia, right, I'm not going to feel anything, but that doesn't mean I'm not in pain. Just because I can't feel it doesn't mean it's not real. So if we're talking about, well, I feel it in my elbow, well, what's sending me signals so that I can feel the pain? Well, part of it is my nervous system, and part of it is my brain, right? That sends the signal that is going, ow, 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 it hurts, right? That's why when you touch a hot stove, it's those pain receptors and it's that signal that your brain is sending which says move your hand. Because if you could not feel pain, you just leave your hand on the hot stove, causing you permanent damage. So that people understand, right? And that like everybody agrees with, like there's a consensus. But the part where people don't know, or that confuses people, that throws them off, is that the same thing happens, except what happens when you look at joint pain and we get a scan and it looks to be fine, right? If we're looking for inflammation, if we're looking for something like anatomically the structure of the joint is off, or we can see bruising. But what if we can't see any of that stuff? Can the root of the pain be in our head? And if that's the case, if we've ruled out the other physical things, counseling or therapy, talk therapy, can improve our physical problems. I know, it sounds wild, and I would definitely recommend you look more into this. Here's the last thing I'm going to say about the brain, the mind, the body connection to really send this home. Lower levels of lymphocytes, which are cells that help our immune system. So like they'll attack pathogens, they'll attack bacteria and viruses to make sure we don't get sick. The lower levels of those sort of cells we are, the more likely we are to get sick. Now, studies have found a correlation between high stress and lower lymphocytes in the body. The way they did this was they tracked university students across a semester, measuring their lymphocytes. And on average, most students, the day before their 40% final, all had lower lymphocytes and higher stress levels than the rest of the semester. And the prior literature, prior research studies suggest that if people have lower lymphocytes and higher stress, they're more likely to feel sick, or they're more likely to get sick because their immune system is not as strong. So if you believe that, if I'm very stressed and my brain is not creating as many cells, or is not diverting its attention to keep me healthy because we're so focused on the danger in front of us, right? Or on the energy expenditure needed to do this task successfully, that I can get sick easier? Is it so wild to claim that something that happened mental health-wise can impact me physically? The mind and body are connected. When we talk about health, it's time to start talking about everything.